station, and you can watch us. We are on your computer, your mobile device. Just head on over to SuperTalk TV. Now, February is winding down. I know we get an extra day this year, and that's a good thing because we can celebrate Heart Month for just a little bit longer. Heart disease is the leading cause of death in both men and women in nationwide, but also here in our state. But we're going to focus on women today. Joining me is Dr. Catherine Lowe. She's an interventional cardiologist with Jackson Heart, and she wants you to take care of your heart. Right, Dr. Lowe?
Yes, thank you so much for having me on. I think Heart Month should be extended all year, but I may be biased.
You know, you are a little biased, and as a dietitian, I have said if on the evening news, which I know this is morbid, but hang with me, if every night they also played a list of people who died of heart disease, along with maybe other gunshot unfortunate sort of events, it would start to wake us up, because for most, it can be prevented or at least intervened in terms of longing your life expectancy when you take those numbers and things seriously that you get from your doctor. So
I completely agree with that, and I think people would be shocked at how long that list is.
I know, and that would be the thing. The news isn't long enough, which is sad and eye-opening all at the same time. I am interested, though, Dr. Lowe. How did you get interested in cardiology? I mean, as a healthcare professional, what led you to this specific field?
I have always been interested in the heart and cardiovascular function since high school. And then going through medical school and internal medicine training, I love the amount of treatment that you could provide from an interventional standpoint, as far as preventing progression of heart disease, preventing heart failure, and really getting to people early and providing education to prevent problems down the line. And I love that even if problems arise in the cardiac system, we're able to treat them 99% of the time and make people better.
And that starts with sort of awareness. So from your perspective, I know it's like a big umbrella term that we say heart disease, because it really is. I mean, that can be all kinds of things. You think during Heart Month it's just about your high cholesterol, and that's one of them, or high blood pressure. But how do you help people understand what heart disease is?
What I tell my patients is that heart disease is anything that will have a negative impact on your heart. We think of it most often in terms of blockages in the heart arteries, and that can be due to high cholesterol, uncontrolled high blood pressure, obesity, especially in our state, or diabetes. Those are our big risk factors, as well as smoking. And heart disease is a restriction of blood flow to the heart muscle from those blockages. That can cause a heart attack, that can cause heart failure. And most people, unfortunately, we don't see until they've already had that disease development and it's caused a problem. And that is how they've gotten to us as cardiologists.
Is there, for some that say it's genetic or familiar, for whatever whatever that F word is, not the other ones, how much can it be nature versus nurture when it comes to heart health?
I think it is a 50-50 split most of the time. There is a rare exception where if you have premature coronary artery disease, which is development of heart disease in members of your family, first-degree relatives, less than 65 years old, that yes, you have a higher risk factor than the general population of having heart disease yourself. Most of the time, as long as you control your blood pressure, your weight, your cholesterol, you're a non-smoker, you'll be fine. But it is important that if it runs in your family, that you do get screened at an earlier period of time, even if you aren't having symptoms.
So screening for heart disease, Dr. Lowe, is that just your blood pressure and your cholesterol numbers, or are there other screening tools out there that we have now to better pinpoint our potential for heart disease?
Fortunately, we do have other screening tools that have risen over the last few years and are very easy to do. One is a coronary calcium score, where is a CT scan, takes about 3 minutes. It's specifically looking for calcium deposits within the heart arteries. If that's present, then we really get aggressive with blood pressure and cholesterol control.
Which we should be doing anyway.
Correct.
Those are easier numbers to get that we should all know. So it's particularly blood pressure, because I know they call that a silent killer for a reason, because you could be living with elevated blood pressure and not recognize it. So that's why It's important not to go off on how you feel, people. You got to know the actual number. But what's going on inside to our heart when we are registering a blood pressure, maybe, over that wonderful 120/80?
So if you continuously have high blood pressure, that is correct. You don't feel it. You feel fine. Your heart is not feeling fine. So think of your heart as a pump, and your heart is having to pump against a higher pressure, and it's having to work harder than it would at baseline. Over a long period of time, that can wear out the heart. They can cause heart disease. It can cause heart failure in some patients. And you really don't have symptoms until your heart is already struggling.
And that's something we want to avoid.
Correct.
So the other number is cholesterol. So how are those two numbers? I mean, I know they're different. We obviously know they're different, but how are they different in terms of how they affect your heart?
So goal blood pressure is something all the time should be 120 or less in order to not be considered hypertension. For cholesterol, your goal LDLs, if you don't have any high cholesterol, any atherosclerotic heart disease or buildup of plaque, should be less than 100. Now, if you do have plaque buildup, we are now targeting your bad cholesterol, your LDL, closer to 55. European studies have shown that is kind of the sweet spot as far as preventing progression of disease.
I know a lot of folks that you have mixed camps, Dr. Lowe. It's like, I don't want to get on medicine, so I'm going to fight for that. But maybe nothing is moving the needle. Or you have those folks that just, get on medicine and then think that that's going to be it. So what is medicine's role in helping us manage both cholesterol and hypertension?
So what I tell my patients that I think is very important is I believe diet and exercise is a medicine. Food is a medicine, exercise is a medicine. And I have multiple patients who say I never want to get on a drug therapy. But I tell them, let's do it and protect your heart while you're doing everything else you need to do to eventually maybe come off those medications if your lifestyle changes. But don't leave your heart unprotected while you're making those lifestyle changes. And so I believe that the drugs protect you until you've lost enough weight that you can come off blood pressure medications, or you've changed your diet enough to where maybe you can come off cholesterol medications. So I always say, don't think of this as permanent, think of it as protection.
Oh, I like the way you worded that. And also don't think of yourself as a failure if you have to live with both, right?
Correct.
Right? Because for some, depending on age, depending on your genetics, just depending on a lot of different things, it's a good thing that we have both to be able to manage. You want to be as on as least medications as possible? No, if possible. But if you do have to have help, be grateful that it's there and that you can still protect your heart.
Correct.
In sort of that way. I've never thought about it as protection. That's like a new way of kind of sort of looking at it. Are you always having to find new ways to give the same information, Dr. Lowe?
I am. I try to individualize it because some patients will absorb, my sweet little ladies will take it completely different than my 35-year-old males, and they may need to be on the same drugs. So I really try to talk to the patient, individualize it, and find something that I can get through to them with.
What would they have already had to have experienced to wind up in your office, Dr. Lowe? Because you are an interventional cardiologist, so you're not the frontline defense necessarily.
So most of the time, they will make it through a primary care provider before they get to me. I do take self-referrals, though, so sometimes I'm the first person they see. But a lot of times I have patients with uncontrolled blood pressure, uncontrolled cholesterol, or they're already having symptoms of chest pain, at which point we work them up for heart blockages a little bit more aggressively.
Which that's nothing to take lightly. You mentioned the words chest pains. How do you know if it's chest pains and not indigestion?
So sometimes it's hard to tell. I look at the risk factors and then the things that you look for heart pains, cardiac pains, also called angina, is whether or not it's related to exertion or stress. So I have patients say, I have chest pain not related with eating, is oftentimes when I'm exerting myself, walking uphill, or I'm really stressed out. And something stressful at work has happened or something of that nature, I get chest pain. And it goes away when I'm calm and when I've rested or when I've stopped exerting myself. Those are kind of red flags. Exertionally related chest pain is a red flag for me that maybe we should look further.
So it's not like you had the burrito and then you feel
Correct.
like you're going to, that still may be a problem,
Right.
which you probably need to address, but it maybe not be that. Because I've always thought it was interesting, like when you say chest pain, the word pain means different things to different people.
Correct.
So is it like a tightness, or is it like a smothering, or what's normally associated with get to the doctor quick?
So there is never, I tell my patients you are individualized, and what may be considered chest pain for somebody else may not be for you. So I always say if it is a tightness, squeezing, something abnormal that you have not experienced before and it does not go away, you then need to seek treatment.
You need to seek treatment, and this affects women more than it does men. We got more with Dr. Lowe coming up next here on Good Things Mobile Device. If you head on over there, you'll see I'm not alone. We're continuing our conversation with Dr. Catherine Lowe. It's the end of Heart Month, so we wanted to make sure we got in some good heart talk. She's an interventional cardiologist, meaning she does all the things, is what I had to look it up. I was like, what's the difference in cardiologists? So you spend your days helping people protect their hearts and preserve their health, which I think is a good thing. Okay, so heart disease does impact women more than men. Why?
So I think that is more undiagnosed in women than men. I think women are less likely to seek treatment. I do think proportionally it is 1 in 3 women will die from heart disease. I know. It is a staggering number. 44% of all women in the United States have some form of heart disease, whether or not they know it. So it's somebody that you probably know has heart disease. Whether or not they've sought treatment for it is a different story. But I think continuing education is important. A lot of times women, we're taking care of everybody else. I hate to say that, but it is true. Mm-hmm. And so we're less likely to seek treatment and get diagnosed and get screened. Some of that is related to lifestyle choices, especially in Mississippi, as far as why we're at higher risk. And then another part of it is hormonal. Lack of estrogen as we get older, hitting menopause, things of that nature do put you at increased risk for atherosclerotic heart disease. So I think that it's important to get screened.
And that's why it's important just to have those yearly wellness visits and having those conversations
Correct.
with your doctor. One thing I see, at least in our state or among a lot, is just the lack of having like a primary care provider that who's kind of like a, who organizes all the squirrels for you, keeps all the cats wrangled, all the things like, and asks all those questions. I mean, is that a good place for anybody listening, women and men, but particularly women, is just to establish a primary care provider, and why can't that be your OB?
Correct. So,
nothing against your OB.
No, I love my OB. She's wonderful, but they are primarily handling pregnancy, obstetrics, and post-pregnancy care when you're no longer having children is just centered around menopause and symptom management. You need somebody that's going to make sure that you are getting the heart-healthy screenings, getting your colonoscopy when you need it, getting screened for different types of cancers as we get older if you have a smoking history. And that is overwhelming for some OBs who are otherwise busy with all of their other pregnant patients, things like that. And as we get older, you need less of the pregnancy side of things. I think females, you need a dedicated primary care physician.
I hope you need less of the pregnancy.
Right, correct. But no matter what age you are, you need a primary care provider that you are seeing at least once a year, if not every 6 months.
Which I think is something most people roll their eyes at. But it is one of those, like if you catch hypertension or you catch just the creeping of your cholesterol, how much better is that than showing up and having, you were talking during the break, like having a 3,000 calcium score or, finding out that you have stage 3 or stage 2 hypertension?
It is life-changing. It can prevent so many problems. And majority of patients are not checking their blood pressure on a routine basis at their house. So the only time they get it checked is if they go to their physician's office. And I would hope that if it's elevated there, they then start screening you more carefully for high blood pressure and having you check it yourself. And controlling problems before they become a problem keeps you from me having to put stents in your heart. So I would strongly recommend getting a primary care provider if you don't have one already.
So the signs and symptoms when it comes to heart attack and stroke for women are just different than they are in men. Again, why? And then what are they? So
yes, women present differently than men. We rarely read the textbook that says I'm having pain in the center of my chest that's tight and radiates to my left arm. Rarely is that the story I've gotten from my female patients. Most of the time they come in and say, I have a little heart fluttering when I'm stressed or when I'm exercising. Or I have one of my partners, his patient said, my left elbow hurts every time I run. And sure enough, she ended up with a stent a week later. Now, I don't want to cause He went to
Everybody just checked their
overthink.
elbows. Like I did. I just like, what is that with my elbows?
But just saying, pay attention. So most angina or heart pain symptoms are located in the chest. They can radiate in the back. They can radiate to the jaw or the arms. And it's really paying attention to your symptoms and noticing if there's something new. Now, why we present differently than men, I don't know. But for women, a lot of times we will downplay, oh, it's acid reflux. Oh, I'm just stressed. And I ask that you don't do that as a female. If there's a new symptom, please have it addressed.
Because, again, knowing as then you can sort of make a game plan. Just putting your head in the sand when it comes to your heart health is not going to fix the situation. Correct. You mentioned the other word here in Mississippi, which is diabetes. Which comes first, usually the chicken or the egg when it comes to heart disease or diabetes?
So a lot of times diabetes is the culprit that will lead to heart disease, especially undiagnosed, untreated diabetes. A lot of patients don't know that they're diabetic because they have not been screened for it at least once a year. And then they come in with plaque buildup in their hearts. They come in with some nerve problems in their legs because the sugars have destroyed their nerves, or they've come in with stroke. And so it's very important to get screened with diabetes. It's definitely a risk factor for heart disease.
Heart disease, Heart Disease Awareness Month, which is February, and it's been for a really long time, is due to the hard work of those with the American Heart Association. I know we have a great chapter here in Mississippi, and I know we've got the Women of Impact campaign coming up, which you're a part of for the Go Red for Women. So what's kind of the mission behind that campaign and Go Red for Women here in Mississippi? So
Go Red for Women is the Women of Impact campaign is to provide kind of like a focused campaign to help provide education, raise funds for women's health, to educate and give talks and social media on women have cardiovascular disease. We are undereducated on it. We are underdiagnosed on it, and we are undertreated. And this is a focused campaign to raise money and awareness to get more women tested and treated and educated. The Go Red Women campaign, all of the funds stay in Mississippi, which is great. They go towards research for trials with women involved. Statistically, women are less than a third of all trial candidates for new drugs, new treatments, things of that nature. And all the money that is raised stays in the state to go towards research dedicated to help women, which I think is so important to lead to new medications, new treatments for heart disease.
And I know that event is coming up June 7th, which feels a long way away, Dr. Lowe, but it is. I mean, we are knocking on March's door, which is nuts to me. So if we want to find out more about that event, how do we do that?
So AHA website, you can type in Go Red for Women or Women of Impact. I have a page on there as well that gives you all of the education and details as far as the event itself, how you can donate, how you can raise awareness, and as well as educational material on what is a heart attack, what is heart disease, what are the symptoms I need to look for, and how I start a conversation with my family. All of that is on there and is great for people who want more information.
So one thing, going back to the medication that I see often, how important is it, Dr. Lowe, that we take our medicine as prescribed?
I tell my patients all the time, I am not prescribing medicine because I want to prescribe medicine. I'm prescribing it for a reason and for a purpose. And at the end of the day, that purpose is to make you live longer, have better quality of life by feeling better. And so it's extremely important that you take your medicine. And I tell my patients all the time, if there is a problem with your medication, there's a side effect that you don't like, or you have a question about it, please don't just stop it. Please call me and we'll have a discussion of why you're on it and the importance of it.
And if you have a good blood pressure day, we don't skip it?
Correct. It is working because you are taking it long term.
And we take our high cholesterol medicine daily too. We don't just take it when we have a high fat meal.
Correct. All of the drugs work best if they have built up in your system and you take them as prescribed.
I'm laughing, but you'd be surprised at what we hear in our clinics, but also too, you may think that why should I, but that's what it's doing. It's working. So you're supposed to take it sort of as prescribed. You don't want to play around with your heart because you only get one.
You do. God gave you one. But,
You might could get another one, but you don't want to be on that list.
right, you don't want to be on that list. We want to avoid that.
We absolutely want to avoid that. But if for whatever reason, Dr. Lowe, we do find ourselves at that intersection of maybe needing an interventional cardiologist or more information for one of our family members, what's the best way for someone to get in touch with you?
With me, so I am one of the cardiologists for Jackson Heart. We have a large group. There are 20 of us. They're there, and you can just call the clinic, and we most of the time can see people within a week and get you scheduled to get screened.
And if nothing else, what I'm taking away is have a primary care provider, know your cholesterol, and know your blood pressure.
Correct. We can start there, and luckily with heart disease, everything is treatable.
Everything is treatable. Well, I appreciate your time, Dr. Lowe.
Thank you.
And you guys stick with us. We got more for you up next.